My name is Dr. Andrew Grace. I am a general surgeon, but I also specialize in treatment of varicose veins and venous disorders. Now, we know that pregnancy is an independent risk factor for getting varicose veins, and even if somebody doesn't get varicose veins after one pregnancy, they'll get varicose vein. The risk for varicose veins goes up with each subsequent pregnancy. So, with that in mind, there are things that we can do to help support the circulation in the legs during pregnancy. That's why a lot of OBGYNs will recommend that women get into some kind of support hose or compression sock. And for the same reasons that support hose help most people, what they do in pregnant women is it helps keep that fluid from accumulating in the lower legs. It pushes that extra fluid back into the capillaries, takes the pressure off the skin, it makes their legs feel better, their legs feel less heavy and less sore. And it probably, by improving or helping support the circulation in the legs, can help to a degree to help minimize the effects of the pregnancy with regards to varicose veins. So for women who develop varicose veins during pregnancy, a lot of them do, as they recover from that pregnancy and as the excess fluid comes off, the hormonal levels reset to baseline, some women's varicose veins will improve. I've seen dramatic cases of women who've developed a lot of varicose veins during pregnancy, where most of the veins have gone back to nothing after delivery. So there's varicose vein treatments, there's using compression stockings, and exercise, and those three things together are the triad of keeping our legs healthy. You can pick out one thing alone, and people could potentially do okay depending on their symptoms or the severity of how many varicose veins they have, but people who tend to do the best do a combination of all three. They have some kind of treatment, they keep up with exercise, and they're using their compression stockings regularly. And people who do all three things together seem to do best than any group that does any singular thing alone.